Dr. Dale Kalina. He's an infectious disease physician. Doctor, good morning to you. So what is this disease? How does it present?
Good morning, Marcia. Thanks for having me back. So meningitis in general is a disease that can be caused by a variety of different pathogens. What we're talking about today is meningococcal meningitis. So it's caused by a bacteria called Neisseria meningitidis. The biggest thing to look for with this type of disease is fevers, chills, a stiff neck, and headaches. And they're not subtle findings, particularly with invasive meningococcal disease or meningococcal meningitis. It is profound. It is sudden, and as advertised, as mentioned, and as talked about in Toronto Public Health, it can also be deadly as well.
How do you get it? How do you catch it?
So the unfortunate thing is that it is communicable. It's spread by droplets in the air, and it is spread from person to person. So coughing, sneezing, and even talking close to other people, it can spread. And that's why we do see outbreaks associated with larger gatherings. We see outbreaks associated with people who live in dorms or barracks. We see outbreaks associated with people going to pilgrimages like the Hajj, and also with larger events like Pride, unfortunately.
How do you protect yourself against this infection?
Yes, there's a lot of ways to protect yourself. There are a number of different immunizations that are directed against invasive meningococcal disease. The reality is there are a lot of different types of meningococcus. So it's kind of like an alphabet soup of different types of bacteria, and there are immunizations against the vast majority of them. We give immunizations routinely to children between the ages of 12 months and 11 years of age. There's a number of different shots. And then we also give vaccines to children when they're in grade 7 as well. And also people that are at higher risk groups. So people who don't have spleens, people who are immunocompromised in other ways, we also vaccinate against those. But the last thing you can do, if you've been exposed, for example, is you can also take a post-exposure prophylaxis, so an antibiotic directed against the bacterial infection developing if you've been exposed to it, which is what we do on a regular basis for people who have been exposed.
But doctor, not everybody will know if they've been exposed, will they?
So you're very right. Many people won't. The reality is public health officials do reach out to close contacts. So if somebody particularly if they get admitted with a meningococcal disease, public health will reach out to them and will also reach out to those contacts that they've identified. So there are a number of mechanisms that are in place, so you should know. And as I said, invasive meningococcal disease is not subtle. It is a rapid onset, but it is quite obvious. And the testing for it as well is quite quick as well. So there are a lot of mechanisms that are in place that can help with that identification piece.
Okay, and just one last question then for you as we wrap up. How concerned are you that this could start spreading rapidly and become something that feels like it is out of control, doctor?
So it shouldn't spiral out of control. We do have a very strong vaccination program here in Canada, and it really does underscore the importance of getting those broader vaccines if you're going to an area where you're expecting to see, meet with, or be close to a lot of other individuals. So I wouldn't expect this to spiral out of control, but it really is a reminder for everybody to ensure that your routine childhood and adolescent vaccines are up to date. And if you're a part of one of those high-risk vaccine capable groups, that you're also talking to your primary care provider about making sure you're up to date.
Doctor, thanks so much. Really important information. Dr. Dale Kalina joining us this morning.